Sanlam's Vision for Change initiative is making significant impact on the lives of school learners in Namibia by addressing the critical issue of poor eyesight. Now in the 5th edition, the program offers eye screening, testing, and the provision of prescription glasses to those in need. We speak to Hilma Petrus, the marketing consultant at Sanlam, involved in the life-changing initiative, to learn more about this impact and future plans. Hilma, welcome.
Hi, thank you.
All right, just to start off, perhaps you can just tell us what inspired Sanlam Namibia's initiative of the Vision for Change project.
Okay, so Sanlam is committed to contributing to the National Development Plan and Vision 2030. And part of that, or something we're really committed to, is education. And you can only really contribute to education if you identify the key factors which hinder effective education. So while we are doing a lot of research, we then identified, there are other areas such as it could be health. Last year we contributed shoes to learners who were walking barefoot to school. And it could be lack of access to educational resources. But really what caught our attention was poor eyesight. So if a learner is unable to read on the board or make out what they're reading, then one, their confidence is then hindered, and as a result, their academic performance deteriorates. And that's really what inspired it all.
Maybe just how does Vision for Change identify and select the schools and learners that benefit from their eye screening and also just getting the glasses, and is it for free?
So a lot of the question that we get while we go to while we visit these schools, even earlier this year in ROUNDUP, was, are we going to pay for it? No.
Yeah.
The whole process from the screening to the testing and the prescription glasses is for free. Paid for by Sanlam in collaboration with our partners, Shaito Nordi. But the screening in itself, when we we really are a big supporter of smart partnerships. And part of that smart partnerships is identifying key partners that can help us roll out this project. We did come to the realization that, we can't work in silos. Our nations has vast geography, so that means that we need to travel to the schools to conduct these screenings, and we can't do it within the year. So we then work with partners such as the Ministry of Education, who have endorsed the project, to say, help us identify these schools, because they do work with the learners on the ground. So they reach out to the educators who then select the learners. And a key thing is that the learners are underprivileged. So it's your learners, let's say your Selma, whose parents can't really afford to pay for prescription glasses. That child who has been going to school but is unable to read, and they can't, and their eyesight is affected, but really there's just no access to the services.
Of course.
And that's how we really select the schools, because we can identify the region, but the ministry really just helps us, and the local authorities and governors, they help us select the schools based on the dear need of these prescription glasses.
Awesome. And Hilma, maybe just some of the success stories that came out of it, and how this project has also just impacted the lives of these children, in terms of them. We have success stories of them improving academically after they receive these glasses.
So at present, there isn't a data tracking system that can scientifically prove how the Sanlam Vision for Change is impacting the lives of the learners. But we make it a priority to engage the principals, the teachers, the directors of education, to say, what is the difference? Has the learner improved in terms of academic performance? And you will see that they will say, no, you know what? Let's say Selma's confidence has boosted, their grades have improved, they're now performing. We do wish, though, we could really track the performance rate of the schools, but that's something we're looking into, to say, how do we track it? But in the meantime, we just purely rely on the positive feedback that we receive from the schools, and we really try and sustain those relationships.
Okay. And just maybe challenges faced and how they were addressed?
Yeah, we were in ROUNDUP the other day, I think 2 weeks ago. And I think in a period of 4 days, we traveled 1,500 kilometers. So we started from Wogenas, Reitoor, we went all the way to Kleinwob, and then when we went to Maltaoe, the tire puncture happened. And sometimes we spend a lot of the hours doing screening. So as we're leaving and it's dark, another tire puncture. So sometimes you don't have a spare tire puncture because obviously the schools are far, the roads are not too good sometimes, because a large part of this trip phase in the ROUNDUP region was gravel road. But what keeps us going is the fact that, you know what, we are committed to enhancing the vision of the Namibian child. And if there's anything that should impact the academic performance or hinder the child from excelling academically, it shouldn't be poor eyesight.
Yeah, of course. I mean, we see people investing in education, health, and other things, but nobody really looks at that part of making sure that the child is the eyesight of the children. But maybe just in terms of longevity, what are you looking at? Is there any plans to make sure that this program continues, even if Sanlam perhaps is not the main overall overseer of the project?
So Sanlam has pillars in terms of projects, and the vision for change is really one of those babies that we just want to see it thrive. That means that we'd like to see it grow. We'd like to go and take screening and testing to the people, because if you look at ROUNDUP region, there aren't any optometrists in the region, and that's why the numbers of kids that require glasses, for example, right now we screened 520 learners, and 288 of them require prescription glasses. So our goal is to see it grow and bring more partners. So as opposed to having one optometrist, we are trying to see if we can work with other optometrists to say, if it means working with 4 to make sure that the Namibian child does get prescription glasses, that too, we'd like to see more corporates come on board. Yeah. And instead of just seeing it as a Sanlam project, perhaps seeing it as a national project. And part of that is really just engaging the Ministry of Education and to say, apart from the collaboration that we're doing, what can we really do for this Namibian child, this child that is struggling to see you on the board and perform academically? So we really want to see it grow, and we're looking forward to see how far this can go. There's a need. For example, in ROUNDUP region, we went there in May for a week, and we thought we would finish the schools, and then getting there, we realized these children have serious problems. So sometimes the optometrist who has, Linnea Shaitonodi, who has over 40 years of experience, and her practice has been in operation for 38 years, would spend close to even 30 minutes to an hour with one learner, and at times would travel back in the middle of the night because obviously of the distance. But the need is just there. There is no access to facilities. Most of these kids have spend many years with untreated eyesight. So there's a dear need, and it's important that as corporates, as service providers in terms of optometrists, as NGOs, as government officers, it's important that we collaborate to ensure to say, how do we help the underprivileged? Because there are people who can't afford to get those prescription glasses, and our hope is that not every child will fall through the cracks and just give up their career as a result of poor eyesight.
And Hilma, just any other plans to expand the project to all the regions in the country, and perhaps just make sure that, also just to see if you are able to extend it to other health matters as well, besides from eyesight? So we are looking on exploring to other regions. We are addressing the situation, taking the elephant and saying taking it by piece, because it's a big project and we can't do it within a period of 1 year. So we've taken, out of that elephant piece, we've taken Msati region, we've taken Zambezi already, we've taken Irongo, we've done Kavango East and Kavango West as well, we've done
ROUNDUP now, and next year again we look forward to selecting another region, and usually that is informed also by our research and our engagements with the ministries. So we will continue to implement the vision for change, and hopefully it grows and more partners come on board.
Yeah, you mentioned now hope partners come on board. So if somebody wants to partner with Sanlam, how do they go about it?
So they can contact our Sanlam officers. They can to speak to either our Marketing Communications Manager, Laurentia Prizonski. She's heading the corporate social investment portfolio, and she's the one that also works with the vision for change, obviously with the support of the rest of the team. And through that, we'll be able to explore the collaboration opportunities, because there is a need for these children. And if we could go back to ROUNDUP region to just provide those prescription glasses and screen more kids and test more kids, that we would. Because in regions like that, we really need to take the services. We had to set up a dark room, for example, to screen, because every service was taken to the schools, from screening to testing, and then choosing the frames and selecting. The whole process was done at the school. And so they can contact our officers. They can email marketing@sanlam.com.na, or even ask for myself, and we'll be more than happy to explore the collaboration opportunities.
And how do you ensure the quality and consistency of the eye screening and glasses that you provide?
So it's important that we collaborate with well-established optometrists, and if it's upcoming, that they are shadowed by an expert. Like I mentioned earlier, Ms. Linnea Shaitonodi has over 40 years of experience. She's been screening and testing for many years. Her practice has been in operation for 38 years. Dr. Optics, also another well-established and qualified practice. So those are really the partners that we're going for, to make sure that because eyes are very sensitive, so you can't just take anybody. And it's important that we partner with the right people that are skilled to conduct these screenings and tests.
Awesome. And what are your plans for the future, lastly, as we just round up the conversation, in terms of the future to expand or enhance the whole project in itself?
So our plans from this project, we've documented the vision for change journey for the ROUNDUP region. So we'll be telling the vision for change story. We've interviewed a few learners to just talk about their journey. When did they really realize that they had an eye problem? And that documentary will be published or released later this year, and that would help people understand the vision. But the next step is to identify which region that we're going to take the vision for change from.
Well, Hilma, thank you so much for being here today.
So much.
And continue doing the great work.
Thank you very much. Thank you for having me.
All right. That was Hilma Petrus, Sanlam's marketing consultant, speaking to us on the Vision for Change project that aims to improve the eyesight of school learners across the country. Be sure to visit their branches countrywide and get your little ones screened. We'll be right back after this break.